Well, I mean, I get slagged for being too bleak on this, but the dangers are that your first symptom can be death. And that sounds very dramatic, but unfortunately for thousands of people, that is what happens. And our job is to try and raise awareness of that, in terms of, if you know a family member, mother, father, brother, sister who has had a sudden death, then you need to get checked. And if you've got high cholesterol, high blood pressure, diabetes, you smoke, all of these things come together in a jigsaw puzzle, and that can lead to heart disease, which, not only can kill you, but could leave you with a long-term condition such as heart failure, which reduces your life expectancy and leaves you with a poorer quality of life. So you want to, obviously we're living longer lives, but you want to live a lifespan that doesn't have 20 years of disease span. You want a lifespan that has a long health span. So that's what we try to promote. Prevention of cardiovascular disease is something that people don't really give a lot of credence to. They think that it just happens and that you can't prevent it. What I'd say is that when you look at some of the early studies like Interheart, between 80 and 90% of cardiovascular disease can be prevented, by really focusing down on risk factors. What I say to patients is that 50% of it is determined by your genetic risk, and there's 50% of it that we can do something about. Overall, if we tackle both, because your environment and your genetics are closely linked, so your genetics load the gun and your environment pulls the trigger. If we can take the bullets out your gun and stop you from pressing the trigger, then we can hopefully stop you from having a cardiovascular event. So yeah, both are very much important, and that's one of the ethos of this clinic that we focus on, is the genetics and lifestyle interaction. So the main lifestyle things that have impact on reducing cardiovascular disease are essentially there's no new things here. It's diet and exercise. It's eating healthily in a balanced way and cutting out what I call crap, which is, carbonated drinks, refined foods, artificial sort of foodstuffs in a packet, and processed stuff that combine carbohydrates and fats together in an energy dense, sort of tasty morsel that we all are wired to love. But unfortunately, the combination of the fat and the sugar that's in that affects our bodies in a particularly bad way, and can inflame our arteries, can have us making too much, bad cholesterol, can raise your blood pressure, can make you diabetic. So that's one end of it. And then obviously, if you're exercising regularly, then you're clearing your body of the energy. I think that's one of the things that we always focus on. Oh, I need to go to the gym, or I need to get back to the gym. No, you don't. What you need to do is make sure that you do enough to sort of give your muscles a good workout and clear it of the energy that's in there. So there's a safe space to put extra energy you might consume, or clear your fat cells a little bit. I always used to say, empty your fat cells, stimulate your muscles, and protect your liver. And if you do those three things, then you're in a good place to try and prevent heart disease. So I think you should see a doctor about heart problems if you've got a particularly strong family history of heart problems, and you're getting into your middle age and you've got some worries or concerns or anxieties about that. In terms of symptoms, if you are experiencing breathlessness, chest pain, palpitations, dizziness, a feeling like you might faint, or an actual faint, or if you exercise and you feel like you're not getting to where you should be, or that you're detuning despite being highly fit, that's something that we'd worry about. If you feel nauseous when you exercise or when you do something physical, that's something else that I would flag in patients. But it's basically the main ones that we worry about are chest discomfort and breathlessness and palpitations. So in Venturi, to determine heart health and to see where you're up to, we do a number of things. First of all, there's the basic ECG, which can tell us a lot about the electrical conductance in your heart and whether your heart is happy and electricity is flowing properly through your heart. We also can do echocardiograms, which is an ultrasound of the heart, a bit like what a pregnant lady would get to look at the baby, but instead we look at your heart and see how the structure and function of your heart muscle is. We also have a CT scanner on site, so we're able to do screening of your heart arteries to make sure you're not building up any plaque on there, and that's called the calcium score test, where we look to see, well, exactly what your risk is of heart disease going forward in the next 10 years. We can also inject contrast in that CT scanner and do something called a CT coronary angiogram, where we see your arteries lit up with contrast, and we can determine whether you've got any soft plaque, any narrowings, and that is the gold standard test, non-invasively, for heart attack and coronary artery disease. We also do point of care blood tests here to look for any stress on your heart, or to look at your lipid profile and make sure that you're not building up bad levels of cholesterol or lipids in the blood. So there's lots of things we can do here on the day, and then obviously we can give you that information on the day and send you home hopefully happy.